Did you know that every year, nearly 1.4 million men are diagnosed with prostate cancer worldwide? That's right. According to the World Health Organization, it's the second most common cancer among men. The scary part? In its early stages, prostate cancer often shows almost no symptoms. It quietly grows inside the body, hidden, while men go about their lives unaware of the danger building within them. This is what makes prostate cancer so terrifying. It's a silent killer. And for many men, by the time symptoms become clear, the cancer has already advanced. Today, I want to reveal the 10 prostate cancer signs I wish I knew sooner. Because catching it early can be the difference between life and death. Let's start with the first warning sign, frequent urination, especially at night. You might think it's just aging. Many men over 50 wake up often to use the bathroom, but when your prostate grows larger, it presses against your urethra, the tube that carries urine out of your body. This pressure makes you feel like your bladder is full, even when it's not. You may find yourself waking up 2, 3, or even 5 times every night to pee. The problem is, many men dismiss this as normal aging, but frequent nighttime urination called nocturia can be one of the earliest red flags of prostate trouble. The second warning sign is a weak urine stream. You start urinating, but it feels like the flow is slow or weak. Sometimes you have to push or strain to get it started. Or it stops and starts several times before you're finished. This happens because the prostate surrounds part of your urethra. As the gland grows larger, it squeezes that tube tighter and tighter, restricting the flow of urine. At first it might seem minor, but as the blockage grows, it can become much more severe. The third warning sign is pain or burning during urination. This burning sensation may come and go. You might blame it on a minor infection or dehydration, but if it keeps happening, especially alongside the other symptoms, it could mean your prostate is inflamed or that cancer cells are irritating the surrounding tissues. The fourth warning sign is one that will stop any man in his tracks: blood in your urine or semen. This may appear as pink, red, or even brown discoloration. While it can sometimes be caused by minor injuries or infections, recurring blood in your urine or semen is a serious warning sign that requires immediate medical evaluation. Studies have shown that even microscopic amounts of blood, invisible to the naked eye, can sometimes indicate early-stage prostate cancer. The fifth warning sign is erectile dysfunction. You might not expect this, but trouble getting or maintaining an erection can sometimes be linked to prostate cancer. When tumors grow, they may affect nerves and blood vessels that control sexual function. This can result in weaker erections or difficulties with ejaculation. Some men notice a reduction in semen volume, delayed ejaculation, or even discomfort during ejaculation. While erectile dysfunction can also stem from other causes like stress, medication, or circulation problems, when combined with urinary symptoms, it should never be ignored. The sixth warning sign is pelvic or lower back pain. This pain may be dull and constant. It can also show up in your hips or thighs. As prostate cancer progresses, it often spreads to nearby bones, especially in the lower spine and pelvic region. Studies from the Journal of Urology have documented that bone pain is often one of the first systemic symptoms of advanced prostate cancer. The seventh warning sign is unintentional weight loss. If you start losing weight without dieting or exercising, that's a major red flag. Cancer changes how your body uses energy. It may cause your metabolism to speed up abnormally, leading to weight loss, muscle wasting, and reduced appetite. If your clothes are suddenly loose and you don't know why, take it seriously. The eighth warning sign is persistent fatigue. This isn't normal tiredness that goes away after rest. Cancer-related fatigue feels like you're dragging heavy weights throughout the day. You may wake up tired, feel drained after minor tasks, and find that naps don't help. Fatigue can be one of the earliest signs that your body is fighting a hidden internal battle. Studies show that the immune system's constant fight against cancer cells drains energy, leading to overwhelming fatigue. The ninth warning sign is changes in bowel habits. Many men are shocked to learn that prostate cancer can affect bowel function. The prostate sits very close to the rectum. As tumors enlarge, they may press against the rectum, causing constipation, discomfort during bowel movements, or a sensation of incomplete emptying. While occasional bowel changes are common, when they persist along with urinary issues, they deserve immediate investigation. The 10th warning sign is swelling in your legs or pelvic area. This is called lymphedema. As cancer grows, it can block lymph nodes and interfere with fluid drainage, causing swelling, tightness, or puffiness in your lower limbs. You may notice your shoes feel tighter, or your socks leave deeper marks on your skin. This kind of swelling, especially when combined with the other warning signs, may indicate more advanced disease. All of these signs can feel confusing because many overlap with normal aging or benign conditions like BPH, benign prostatic hyperplasia. That's exactly what makes prostate cancer so dangerous. It hides behind what seems normal. It whispers quietly while growing stronger inside your body. And that's why early detection is absolutely critical. The good news is that if prostate cancer is caught in its earliest stages, it is one of the most treatable cancers. According to the American Cancer Society, localized prostate cancer has a nearly 100% 5-year survival rate when caught early. But once it spreads beyond the prostate, survival rates drop sharply. That's why so many men, especially after age 50, should pay close attention to these signs. And if you have a family history of prostate cancer, a father, brother, or uncle who was diagnosed, you may be at even greater risk. Genetics play a role. So does race. Studies have shown that African American men are at higher risk and are more likely to be diagnosed with aggressive forms of prostate cancer. If you fall into these high-risk groups, it's even more important to monitor your health and get screened early. I know this all sounds frightening, but there's power in knowledge. The sooner you recognize these warning signs, the sooner you can act. Delaying action can allow cancer to spread silently, but catching it early offers you options, many options, that can fully eliminate the cancer or keep it controlled for decades. The most important takeaway is simple. Don't ignore changes in your body. Don't chalk up new urinary symptoms to getting older. Don't assume erectile issues are just stress. Don't explain away fatigue or weight loss. These could be your body's early warning system. Pay attention to it. Every year, thousands of men survive prostate cancer because they took action early. But sadly, thousands more lose their battle simply because they waited too long. And that's what makes videos like this so important. Because if even one man watches this today, recognizes these signs, and goes to his doctor early, it could save his life. Think about that for a moment. Now that you understand the 10 key signs to watch for, you might be wondering, what can I do right now to reduce my risk? Is there anything you can start doing today to protect your prostate? Yes, there is. Now that you know the warning signs, let's focus on how to protect your prostate starting today, because you are not powerless against this disease, even if it runs in your family, even if you're over 50, even if you've started noticing some mild symptoms, there's still so much you can do. And everything I'm about to share is backed by solid scientific research, not internet myths or fads, so listen closely, because your future health may depend on it. The first and most powerful tool you have is your diet. Food is not just fuel, it is information. Every bite you take sends messages to your body, and some foods turn on cancer-fighting genes while others fuel inflammation. Let's start with the best foods for your prostate. Number 1, tomatoes. Tomatoes are rich in lycopene, a bright red antioxidant that has been heavily studied for prostate cancer prevention. Several studies, including a major review published in the Journal of National Cancer Institute, show that men who eat more tomatoes or tomato-based products have a significantly lower risk of developing prostate cancer. Lycopene works by neutralizing free radicals that damage DNA. It also helps reduce the growth of cancer cells. But to absorb lycopene effectively, cook your tomatoes. Cooking breaks down the cell walls and makes lycopene more bioavailable, so enjoy tomato sauces, soups, and stews regularly. Next, load up on cruciferous vegetables. These include broccoli, cauliflower, Brussels sprouts, and kale. They contain a compound called sulforaphane, which has been shown to trigger cancer cell death and reduce inflammation. One fascinating study from Johns Hopkins University found that men who consumed more cruciferous vegetables had a 45% lower risk of aggressive prostate cancer. That's huge, and it's as simple as adding steamed broccoli or cauliflower to your meals a few times per week. Third, eat more fatty fish like salmon, sardines, and mackerel. These fish are loaded with omega-3 fatty acids, which are powerful anti-inflammatory agents. Chronic inflammation is a key driver of many cancers, including prostate cancer. Omega-3s help dampen that fire, reducing the chances for cancer cells to grow and spread. Studies have consistently shown that men who consume omega-3-rich fish have lower rates of advanced prostate cancer. Fourth, add pomegranate to your diet. Pomegranate juice and seeds contain powerful polyphenols that inhibit the growth of prostate cancer cells. Research published in Clinical Cancer Research found that pomegranate extracts slowed PSA doubling time, meaning it slowed cancer progression in men who already had prostate cancer. It's a simple, delicious habit that may offer real protection. Fifth, drink green tea regularly, especially Japanese matcha or high-quality green teas rich in catechins. Studies from Asia show that men who drink green tea daily have lower rates of prostate cancer. Catechins interfere with cancer cell division and may reduce tumor growth. Just 1 or 2 cups per day can make a difference. While you add these protective foods, you must also reduce harmful ones. Limit red meats, processed meats, fried foods, high-fat dairy, and sugary drinks. These foods promote inflammation, insulin resistance, and hormonal imbalances that can fuel cancer growth. Many studies, including research from Harvard, link high intake of animal fats and processed meats to higher prostate cancer risk. Now let's move beyond food. Your weight plays a huge role. Obesity increases estrogen levels while lowering testosterone, creating a hormonal environment that promotes prostate cell growth. Obese men are more likely to develop aggressive forms of prostate cancer. Even a modest weight loss can lower your risk significantly. Aim for at least 30 minutes of moderate exercise 5 days a week. Simple walking, light strength training, swimming or cycling can be extremely effective. Regular movement helps balance hormones, improve circulation, and strengthen immune function, all of which protect against cancer. Next comes perhaps the most critical step, regular screening. Early detection saves lives, period. Men over 50 or over 40, if they have family history, should talk to their doctor about prostate screening. The 2 most common tests are the PSA blood test and the digital rectal exam, or DRE. The PSA test measures levels of prostate-specific antigen in your blood. Elevated levels can indicate prostate issues including cancer, but PSA is not perfect. Sometimes levels rise for non-cancerous reasons. That's why the DRE helps doctors physically check for lumps or abnormalities. While these tests aren't flawless, they often catch early changes before symptoms appear, and catching prostate cancer early offers the best chance for a full cure. Don't let fear stop you from being proactive. The discomfort of a simple exam is nothing compared to late-stage cancer treatment. Besides lifestyle and screening, certain natural supplements may support prostate health, but only when used wisely and discussed with your doctor. Saw palmetto is one of the most popular. It's been shown to help reduce prostate swelling and improve urinary flow in men with BPH, though its role in cancer prevention is less certain. Zinc is another essential mineral. The prostate contains more zinc than any other organ in the body. Zinc supports immune function and proper DNA repair. Some studies suggest that low zinc levels may increase cancer risk, but again, don't overdo it. Balance is key. Vitamin D is critically important. Multiple studies show that low vitamin D levels are associated with higher rates of prostate cancer. Since many men over 50 are deficient in vitamin D, it's wise to check your levels and supplement if needed. Curcumin, the active compound in turmeric, is a potent anti-inflammatory with anti-cancer properties. Research suggests that curcumin may slow prostate cancer cell growth and reduce metastasis. Adding turmeric to your meals or taking a high-quality curcumin supplement could offer additional protection. However, always consult your healthcare provider before starting any supplement. Even natural substances can interact with medications or conditions. Finally, never underestimate the role of stress and sleep. Chronic stress raises cortisol levels, which suppresses your immune system's ability to detect and destroy abnormal cells. Sleep is when your body repairs DNA damage and clears out cellular waste. Poor sleep weakens your defenses. Simple daily practices like deep breathing, meditation, yoga, prayer, or even peaceful walks in nature can lower stress dramatically, improving both mental and physical resilience. Quality sleep, at least 7 to 8 hours per night, should be non-negotiable for prostate health. These steps are not complicated. They don't require expensive treatments or extreme diets. They are simple, actionable changes that, when done consistently, can significantly lower your prostate cancer risk. Your future health isn't about one massive change, it's about daily habits done well, consistently over time. The power is in your hands. Remember, prevention is always easier than treatment. You now have knowledge that many men still don't. Use it, share it, talk to your doctor. Encourage your loved ones to get screened, because awareness saves lives. And even if prostate cancer is diagnosed, early detection combined with a healthy lifestyle gives you the best possible outcome. But what if you do get diagnosed? What happens next? Don't worry, in the final part of this video I'll explain the latest treatments, incredible new breakthroughs, and how many men today are not just surviving but thriving after prostate cancer diagnosis. Stay with me, the hope is stronger than ever. If you've made it this far, you might still be wondering what happens if, despite all your efforts, you are diagnosed with prostate cancer. And this is where I want you to feel hope, because treatment options today are better, safer, and more effective than ever before. A prostate cancer diagnosis is no longer a death sentence like it was decades ago. Today's medical advances allow many men to live full, healthy lives even after diagnosis. Let's go through the options carefully. The first option for many men, especially when cancer is caught very early, is active surveillance. This means closely monitoring your cancer with regular PSA tests, digital rectal exams, and sometimes biopsies, without rushing into aggressive treatment. Because some prostate cancers grow so slowly that they may never cause harm, especially in older men, doctors carefully weigh the risks and benefits, so you avoid unnecessary side effects from surgery or radiation if the cancer isn't progressing. The second option is surgery, known as radical prostatectomy, where the entire prostate gland is removed. Surgical techniques have advanced tremendously, including robotic-assisted surgery that allows for more precision, smaller incisions, faster recovery, and fewer complications. Surgery is often recommended for younger men with localized cancer who have a long life expectancy. But like any surgery, there are risks, including possible urinary incontinence and sexual side effects, which is why early detection makes such a difference. The smaller the tumor, the better the outcome. Next is radiation therapy. This can be external beam radiation or internal radiation called brachytherapy. Both aim to kill cancer cells while sparing as much healthy tissue as possible. Radiation can be as effective as surgery for many men, especially for those who are not ideal surgical candidates. Side effects may include fatigue, bowel issues, or erectile dysfunction, but newer radiation methods are much more precise and cause fewer complications than in the past. Another common treatment is hormone therapy, also called androgen deprivation therapy. Prostate cancer feeds on male hormones like testosterone. By lowering testosterone levels, hormone therapy can slow or even shrink the cancer. It's often used for advanced cases or combined with radiation for better results. However, long-term hormone therapy can cause side effects like weight gain, hot flashes, loss of bone density, or mood changes. Doctors carefully monitor patients to manage these effects. But here's where the most exciting breakthroughs are happening: in immunotherapy and targeted therapy. Scientists have developed treatments that help your own immune system recognize and destroy prostate cancer cells. One such breakthrough is PSMA targeted therapy. PSMA stands for prostate-specific membrane antigen, a protein found in high amounts on prostate cancer cells. This treatment attaches a radioactive molecule to the PSMA protein, delivering radiation directly to the cancer while sparing healthy cells. Early studies show promising results even for advanced, treatment-resistant cases. Clinical trials continue to improve these therapies, offering new hope where there was little before. Researchers are also exploring gene therapy, where faulty DNA in cancer cells is repaired or replaced, and precision medicine, where treatments are tailored specifically to your cancer's genetic profile, allowing for highly personalized care. The future of prostate cancer treatment is bright, and every year, new options emerge that make this disease more manageable and even curable for many. Support groups, integrative medicine, nutritional counseling, and mind-body therapies are also playing an important role in helping men navigate the emotional and physical challenges of cancer treatment. You are never alone in this fight. Thousands of men have walked this path before you and emerged stronger, wiser, and healthier. If you take one message from this video, let it be this: don't wait for symptoms to scream before you act. Listen to your body's early whispers, take charge of your lifestyle, get screened regularly, and stay informed. Knowledge gives you power, and power gives you options. Prostate cancer may be common, but with early detection, smart choices, and today's advanced treatments, survival rates are higher than ever. Share this video with your father, your brother, your son, or your friend. It might save their life. Thank you for staying with me. Remember, your health is your greatest wealth. Protect it fiercely.